Thank you. Oh,
Just one or two.
thank you very much. Thank you very much.
Sir,
Oh,
चित्तौड़ की मेमोरी
oh yes. Victory time. Thank you. बहुत बहुत शुक्रिया. So after seeing so many patients for so many times, I do have some authority to say that there is something we should look for in the tongue. Similarly, they should look into the eyes, right? Just to see how the capillaries are placed, what is the color. If the capillaries are dilated over a period of time, then the iron gets, oxidized, and you get this browning patches thing. So like that, you could see a lot of things on the sclera, but also they developed a system of looking into the iris. Now, iris, if you look at it very bluntly, is the part of the nervous system because it constricts with light. Okay, the pupils, they constrict. So whatever inflammation, pain, trauma the body has suffered, doesn't matter where it was, will show the changes in the trabeculae, changes in the markings of the eyes. It became a whole science called iridology, So the person who started it, Jensen, he was doing autopsies. They had diagnosis of people and autopsies of those people, and he found a correlation between what we saw. So he made charts and diagrams. So that became a thing. I'm not saying it will be 100% correct, because there's some genetic factors which sometimes, give you a false impression. It's amazing coincidence. You must have seen, reflexology. You press the, feet, and you say, if it's hurting somewhere, and the person will say, you've got some gallbladder problem, or you've got problem with the back. So this, they're doing acupressure and all sorts of things. These are all reflections, how the body is interconnected, Okay, we do ECG, right? Picking up electrical current circuit here and there. But there are other systems going on in the body which we do not know about. And this is one of them. With 42 years of clinical experience, I can say with confidence that there are other links between trigger points or zones of the body and a particular organ. We know pain in the back could be a gallstone, or there are so many trigger points in the body that we know about, we doctors know about, but there are so many different things. So this whole system, I was bringing doctors, NHS doctors, to Vijaypur area. He knows that. So many doctors, NHS doctors have come here. And I used to go to hold camps in remote villages. And I used to teach them the permutation and combination of all these things. Because this is treatable. So we started studying this, especially the current king, Prince Charles. He was very interested in this. So we did a foundation, and now we have a school, a medical school, which studies all these things. They're all my students, of course, but I couldn't go because it's in Scotland, and I live in London. It's difficult. So we, in the college, Royal College of all this integrated medicine, they are studying this. They are doing some research. I know that it's in a very primitive stage, but here's what the statistics are. 65% of people in UK, for example, use some form of alternative, integrated, whatever, medicine. Be it osteopathy, be it acupuncture, be it Ayurveda, be it whatever. Now Ayurveda is so popular, or yoga. 65% of people. And there is another interesting thing, that for breast cancers, those who survive, out of that, 70% have used some form of, and this is an official data, some form of alternative or natural thing, be it meditation, be it changes in the diet, in their lifestyle. So this is in a budding stage. I won't say budding, has gone quite far, because in hospitals, in pain clinics, acupuncture is used very widely. Some clinics are doing some research on skin ailments and herbal medicine, and so many of these products are now being licensed. You can buy, you can buy amla, you can buy all these things, not only in UK but in America. You get all these things. The number of, shilajit, which is used so commonly, it's the top selling Indian medicinal product in the US. Something that, and it's not that you present it just like that. FDA won't allow. They have to have some research, some toxicity studies, and some other things like that. So I think it's coming. It's coming. And what I was discussing was that we should not foo-foo this Ayush business. Because there are some things like that, but these guys, they start fighting with each other. Ayurveda saying Unani is bad, Unani saying Siddha is better, and so they're fighting. They're not united. It's not a united ministry. They brought politics in it. You have to have medicine controlled by doctors. It's time for us to learn some of their techniques and integrate it in our system of things like that. So the NHS doctors I brought here, so many of them, they have gone back and they have put in a general hospital. Of course, they work in the government system. They have a 6-minute consultation time. You get 6 minutes. So they do a quick analysis of all this, after training, of course. The tongue, the eyes, and takes about maximum of 2.5 minutes. And then the rest of it, they consult and they look at tests wherever necessary. They combine the two and they see, where the diagnosis meets. So they can easily write the prescription. Even if you're treating symptoms, you're waiting for the results of tests, you're able to prescribe something within the 6-minute consultation period. It's very well used in the OPDs. Not everywhere, but at least they started thinking about it. You see? So this being that. Now, talking about treatments, the trend is that 60 to 70% of people are suffering from chronic ailments. The fact that a disease becomes chronic from an acute stage shows that the remedies that were used or the techniques that were used didn't work very well. And you repeat the prescriptions and you tell them to continue with the same medicines or change it to different brand name. But basically that's what is happening. Personally, I have studied in details the system of Hippocratic medicine, right? Hippocrates, we take the oath of Hippocrates. But what he really taught is not known to us. He taught a few very interesting things. He says that we all have an innate healing power within us. Same thing as nature. You break a lizard's tail, it will grow back. You break a twig, a branch, it will grow back. So we have an innate healing power within us. He says we can use that for treating 80% of our ailments. Okay, life wasn't as complicated as now with diet, with fast food, with this, that. But those days, that was the principle. By the way, Unani took those principles. Yunan means Eastern Greece, Yunan. So Unani comes from that. They changed a lot. It's not the same system. So Unani has become like another herbal medical system. But they left all the other systems. So what Hippocrates said was that to stimulate the innate healing power, you need changes in your diet or nutrition. You need to do some exercises. You have to have some physical therapies, whether it's massage or oil therapy or whatever, right? And you have to give your mind a rest. Now, this is as simple as it gets. So they developed a system whereby they used to call this a parez. If you go to a herbal thing, the first thing he says is parez karo, is cheese. So this is like a parez, okay? But it's got forgotten. So I use that Hippocratic principle to boost the innate healing power for chronic ailments. And the results are there. The results are there because you see the three main things which I do in my practice. One is alkalize the body. The more acid you have, more digestive problems you have, more, I mean, there's so many links between high acid and susceptibility to pain, skin rashes, joint inflammation. Nobody has studied them, but in general conversation it comes up. The second thing I do is that what drains that innate healing energy in you are these inflammations, be it gastritis, be it arthritis, be it gingivitis, be it sinusitis. Any inflammation in the body drains your energy because the body has to focus on it all the time, 24/7. So we get rid of the inflammation by using natural. Now what I do is, how I broke the system is I use culinary herbs. All these herbs and masalas that you use, right? They can be made into medicinal, for example, turmeric or even chilies. They can be made into medicinal product, provided you use a different technique. I know we do the silbatta and all that, but there is a different system of making tinctures, making powders, very fine powders, making products mixed with ghee, ghritam, and bhasma is burning ash. So I use a lot of culinary herbs, starting from turmeric to aniseed, but use a different technique of preparing them. For example, the turmeric that I use is pulverized to such a level that it floats in the air, because it almost becomes like a nano product, right? You have snuff, naswar, you put a little bit here and you start sneezing, because it's made in a special way, so to make it very fine, it almost floats in the thing. So you're using that variety of things which are used in traditional medicine, common things. There are so many over-the-counter medicines which are of herbal origin, starting from cough mixture and all that. The regulatory system does not put a lot of pressure on these things because they're supposed to be traditional stuff going on for thousands of years. Now, I had got exemption for using some Ayurvedic products because I used them for 25 years before the regulation started. So if something was used for so many years, 15 years, and didn't kill anything, it should be safe, right? So there are so many loopholes in FDA, in in the other regulatory system. But I think sooner or later, if the quality of medicines increase here, I don't think the Ayurvedic people are honest enough to make very high quality stuff. The purification process is still not up to date, but one day this can happen. So this is the trend. Now, I use a lot of physical therapy, and one of the things that I use very common is this. This is the vertebral arteries located inside the cervical spine. Okay? The only artery in the whole body which is protected in a canal. It is not exposed. It's protected in a canal and a sheath in such a way that no damage is done. So this is the reptilian artery, right? Mammals, funny enough, have the carotids. So I did quite a lot of work by, again, hit and trial method on my neck connection treatment, and I proved that the autonomous brain, or subconscious brain if you call it, gets its blood supply primarily from this, right up to circle of Willis and all that, right? And the carotid artery primarily sends blood to the conscious brain, right? And so if we have these strokes in two different arteries, you see the result. Stroke in vertebral artery will lead to death because all the vital centers are there, right? So if you look at the autonomous brain, it has vital centers for literally everything. Your energy, your immune system, your hormones, your heart rate, your breathing rate, your fluid control in the body, etc., etc. Your sleep, your well-being, your depression, your panic attacks, all this starts from here. So now, there's a problem with this. The neck is fragile because you have to move your neck in all sorts of directions. So, the chances of dislocations of the joints here, cervical joints, is very high, right? So, because we have to look left, right, and all sorts of directions, and a fragile joint. So, because of these dislocations, the blood flow to the autonomous brain, the vital part of the brain which causes diseases, gets disrupted, right? So I took up cerebral palsy, right? Cord around the neck, and chances are that about 50% of these children will be born with cerebral palsy or so many different things. As we speak, there are 4.8 billion claims against obstetricians who delivered babies and caused some sort of damage. This is in UK, they haven't paid it yet. 1 in 5 births nowadays, because of lack of time, people have shifts and this, that. 1 in 5 and children are having problems with birth injuries. It's not only cerebral palsy, it's autism. So I started working on cerebral palsy, autism, and I found that one of the branches, posterior cerebellar, supplied blood to the cerebellum. Till now, we don't know what the cerebral function is. We say balance, coordination, but it's a lot more. The whole problem of coordinating different organs, systems, is controlled from there, the cerebellum. So only now, recently, in the past 2 years, they're doing research on cerebral blood supply, and they found that there's a link with autism, possibly even linked with Parkinsonism. So all these coordination problems that you have, plus psychological problems. I have done dozens of cerebral palsy. I know this subject like that. Cerebral palsy. Today these children are walking around in the villages. All these people, they come to me. I teach parents to do the treatment. Something is wrong because I couldn't be here for more than 10 days, let's say. This time I spent a little bit more. I'm trying to get this all together to make an app, but this is just a precursor to an app. So where I teach physiotherapists, patients, whatever, to treat themselves, right? That is the idea, because for chronic illness, I don't touch acute illness. No heart, no emergencies. For that we are there, So we've got enough time for that. We can use robotics if we want. We can use what we want, right? To destroy our earned points in medicine. It doesn't matter. But for chronic ailments and for disabilities, I have done so many stroke cases. Today, all these villages, I had some whom I had treated maybe 10 years ago. I taught the relatives. They came and did pranam and, and improved speech. I remember some of them in the Gujar village and this, that. So this leg connection treatment is used. I've had cases of infertility treated with stimulation of the pituitary gland. I've had migraine. I've had sleep disturbances, emotional problems, panic attacks, problems of the immune system, all treated. I'm saying not treated, but together with other systems, but helped with this treatment, because the alertness that you get from such a treatment is quite amazing. This particular person can move his arm. He's walking all right. Move his arm, but that's why everybody thinks he's not all right. Except that, you get this, with stroke, you get a little subluxation of the joint, right? And the deltoid should be able to pull the ball into the socket properly. So most of these people who are with good strength, and yet he is walking around as if he's got severe disabilities. That is basically because of the shoulder issue. So you need to shoulder, first you have to massage the bicipital tendon, right? And the deltoid, rotator cuff. And there is a sorry, I'm taking your time. Rehab always takes a little. अच्छा, अब हाथ उठाओ. Much better than. Now if you keep doing, once he raises his arm, he'll be able to rotate it and improve it further. So and his power is there. The typical case, everything is there, but because of this immobility in the shoulder, he's not been able to do anything like put on his shirt or do his buttons here. Everything is being disturbed by the shoulder. So again, by treating the shoulder, right, you can ease the person. How did I know it? I just watched him. Right? Watching is so important. If you look down and start writing, you don't get it. You watch, you get telltale signs for a whole lot of things. As I told you, you look at the tongue, look at the eye, and feel the pulse. Watch and observe. Look for telltale signs. So in his case, he's all right. Of course, he could benefit with a little bit of neck connection massage to get the blood flow organized. So this is what I'll do. Get the shoulder sorted out, the neck connection, he'll be all right. Otherwise, he's as well as he should be. But again, the hip joint and shoulder joints are not really treated very well by physiotherapists. They focus on the gross movements and they forget about all this, because you have to give a lot of exercises for that, because they make an attempt, it doesn't go up, right? So they leave it. If it doesn't improve in 8 weeks' time, they just leave it. And that is the problem. It's a re-educating people. Okay. और कोई है कहना चाहते हैं? क्या तकलीफ है आपको?
हाथ में जलन होती है।
अच्छा बैठिए। पूरे हाथ?
नहीं, उंगलियां में इसमें नहीं होती, इसमें नहीं, बाकी सब में जलन।
Probably carpal tunnel. So for that, what we do is we treat here. आप ऐसे करके सोचते?
सुन पड़ जाती रात का ज्यादा।
हाँ, थोड़ा नेक का भी है।
फिर जलन होने लगती।
यहाँ से करंट जाती है कई बार?
ये खाली उंगलियां होती है।
आपको यहाँ पे करना पड़ेगा।
यहाँ पे कुछ नहीं लगता है।
ये ऐसा करना।
ठीक है।
वीडियो बनाना।
Now some of you doctors, you come up if you have any problem. Let's get a backache. The shoulder was not looked into properly. I mean, there's a bit of a negligence, but the visceral tendon is so inflamed because it goes into the capsule. So when it rises, as soon as it touches the acromion, they'll go into a spasm anyway. In her case, it's the tendon of the biceps which is restricting her movement, not really the stroke. ट्राई करते, उठाइए इसको और उठाइए। No, you have to do more. I'm not happy. Let's physically do that. हाँ, ये अब उठाओ, कोशिश करो फिर से, खींच नहीं, ऐसे ही उठाओ और खींच से तो होगा। चलो करो।
उठाओ ऊपर तक उठाओ और ऊपर तक।
Dr. B. Talal. Now, he's got what looks like a lower backache. You can call it lumbago or whatever. He's got that, and it's hurting today.
हाँ सर थोड़ा
Huh? Lie down. So, he's got spasm in the lumbar muscles, okay? Normally you go to physiotherapy, they'll do a lot of treatment, bending backward or whatever. But the actual problem is in the pubic bone. Is it painful? So the rectus abdominis and the pubic bone this happens when you have a little bulge in the stomach or in pregnant women and other things. Okay, now stand up, please. खड़े हो जाइए. He is standing more erect, that I can tell you. How does the lower back feel?
हाँ थोड़ा लग रहा है कम.
So if you do this, it will go. So the body is so intricately balanced. Now, I did a lot of work and I wrote a book called Dr. Ali's Ultimate Back Book. In it, I discussed a very interesting topic. So the discs are compressed like this in the bulge. But what I proved is, in 60% of the cases, the compression is due to torsion, not due to vertical compression. The compression is due to torsion. And the torsion is created by the anterior muscles of the spine. So most of these backache, does anybody have sciatica here? Or most, so most of the backaches come from lateral torsion. So that's why when these guys are doing manipulations, they give relief, instant relief, because they're doing just that. They're fixing the torsion in a very crude way sometimes. You know, they just press like that. But if you study the technique of releasing the torsion in these muscles, which is why they've been pushed like that, and there is disc bulge, there is involvement. So in my type of treatment, what basically I do is through some exercises and treatments without manipulation, I try and get the disc moved 1 millimeter away from the nerve, and there's no pain at all. So just need 1 millimeter. No? It shouldn't touch the nerve root. So 1 millimeter of postural change through all these massages, it's a possible thing. It's something that you can achieve. And once you achieve that, then you give them exercises, make them lose weight or whatever. But you have to achieve that 1 millimeter, which can happen quite quickly. This is what I did in this case. Okay? For lack of time, we didn't do the full thing, but you try and do this yourself.
Yes, sir.
Go right down to the pubic bone and mop it. Wherever you get sciatica from hip point. Then, as I said, the problem of groin, inguinal region, another type. Problem of tendons, of the quadriceps. If it tightens up, your whole body will change, in order to protect that pain. So you have a spasm. Then another very common thing is that people are getting pain on the front side. Hypersensitivity, you can't touch, pain, occasional numbness, and all that on the front of the quadriceps, not laterally, right? So this is so a lot of people have even had lumbar surgery to get rid of this, and this is purely L1, L2, right? The pressure is on L1, L2. So when you don't drink any water, you're diabetic, you're dehydrated, and all that. You have problem with the kidneys. Kidneys are embedded in the lumbar muscles. All sorts of things happen, and you get pain there. So increase the water, this, that, and press L1, L2 vertically, and almost instantly this burning pain goes away. For that, people who sit a lot, driving cars or sitting on chairs, they get tightness in the buttocks, the gluteal region, presses the chest. That's another type. Pregnant women, typically before delivery, 8 weeks or 6 weeks before that, all the bones soften up, and you get this pubic bone. By the way, I do painless delivery also through this. Because although during labor, there is a lot of contraction, right? But the main reason why the contraction becomes heavier and heavier is because of the tightness of the birth canal, right? If there's somehow, if it is dilated, it just comes up. So that tightness is caused also by spasm in these rectus abdomini and all that. So, and you are not touching the uterus and all. You work on that area slowly, right, and gradually, especially during contractions. I treat period pains like this. I teach mothers and sisters to, friends, to do that when they have period pain, they faint, they have severe pain, just by relieving this. Even sometimes you have retroflexion and also anterior. So those will remain, but to ease the flow of blood, you need to work on this. There are so many little things that are involved by, by watching, observing, studying. So it's not a fluke science. I will remain a doctor always, but I'm going to probe further and further and bring out all these secrets in the body, for which you have to touch, you feel, you observe, you make note of it, and through experience you'll get it. There are so many things. Next time, for example, if you see a case of pancreatitis, look for white spots on the body. If the amylase is high, there are areas of small pigmentation. If the acidity is also high, so when you see those small white spots, kuch nahi hoga. Not vitiligo. I'm talking about small white spot. They're almost bluish in color. When you think about acid, ask the questions. So let's study his tongue. Jib nikhalo. Okay. All right. First of all, he's got depigmentation of the lips, right? Quite a lot of sort of dryness. Stick your tongue out. Okay. You see the impression of the teeth at the side of the thing and grayish white coating. This gentleman either eats too fast or has acidity problem. Right? So, chilies.
You like chili?
Huh?
Non-veg. No, fast food no. Spicy medium.
But nuts?
Only chapati.
Orange, lemon?
No.
But anyway, the fact is, these telltale signs won't come here if you didn't have the problem. Okay, maybe you're not feeling it, but stick your tongue again. Yeah, sure. Okay, I wanted to show you that he would have told us that relief hai ki nahi. But because if you had acute, all these ladies that I've been seeing in the villages, they stand up and go. Anyway, इसका ये है, तो इसका treatment जो होगा, you have to start with L1, L2. That's where you massage to get more power into the quadriceps. So the knee joints, they go bone on bone, and they have osteoarthritic changes because the shock absorbers are not working well. So you improve the shock absorbers. The reason why your knees don't crack when you jump from a height is because the shock absorbers take the shock, which are the quadriceps, basically hamstrings, quadriceps. So if L1, L2 is massaged, right? ले जाओ जल्दी से. Prone position, sir. And because he has osteoarthritis in both the things, so L1, L2 is going to be very sensitive. That's a telltale sign that something is going on. So, I mean, just to pain hai? Yes. Yeah, come here. So the moment you go to L1, L2, it's sensitive. Yes. Same pressure above or below will not give you pain. So this is where the pain is. So nature sort of gives you a hint. So you do L1, L2 and certain exercises. One of the exercises I gave is turn kar jao for the quadriceps. इसको पुश करो, मेरे को पुश करो जोर से. और so you go do 10 of these and 10 of these, और तो and then yeah, that's right. So ये जो infrapatellar area है, you have to do that because that's why सीढ़ी चढ़ने में ज़्यादा दर्द होती है कि उतरने में. And then posturally you can see that this toe has moved like that, so the hip joint is already getting involved, right? यहाँ पे भी करना था, करना
मसाज
ये चीज करनी है. ओके, यहाँ मसाज करना है.
आपका ये भी करेक्ट.
ठीक है. ये एक्सरसाइज और कमर में बीच के हिस्से में आप करते रहो.
10-10 सेट दिन में 3 बार.
हाँ ठीक है. And then the quadriceps will get strained, but when he walks, he won't get the impact. No, even in extreme case of knee on knee, if you do this treatment with some quadriceps strengthening, at least you'll be able to go to the toilet and move around because you're building up the shock absorbers. I've done it with sports people. I've done it with they've got tough muscle, but they get injuries.
I developed the pain here where you
pressurized, sir. Nowadays, I have developing.
Drink enough water.
जी सर.
पानी को पीते हो नहीं पीते हो?
पीता हूँ पानी.
किडनी में स्टोन था,
नहीं सर.
उसको करो. He's got pain already. Yeah. ठीक है.
Yes sir. Thank you sir.
ये है तो हमेशा पेन रहता है और नमनेस रहती है पेशाब पूरे में।
इसमें
तो बैक पेन में
yes, you have to press this area. See? Sensitive?
yes more
Okay.
yes
You do this area and do the same thing as I showed you. This below the mandibular and this. Okay. And then do you get numbness at night?
every time
You have to do that. Okay?
Yeah.
थोड़ा सा you can brachial plexus के ऊपर भी. Yeah. And here. The scratching is going on there, you know. So. ठीक है. Next time I'm here in this area, we'll meet again. We'll do some more lessons.
And we, as our tradition of Mewar, we have just honored, sir. This is nothing for you.
Thank you.
And we will happy if you second time.
Yeah.
Whenever
We'll
you
do a
come,
longer session.
you will take longer session.
Interactive.
And even if you just launched app,
Yeah. I'll let you know.
you get me know, so we can join our colleagues.
All these things that I'm talking about, you can go into the relevant section.
So thank you, sir. Again, by heart, we are thank you.
Thank you.
और आप सबको भी मैं बहुत बहुत आभारी हूँ कि आपने आपके बगैर ये जो कहते हैं गुरु गोविंद दोनों खड़े काके लागू पाए, तो बलिहारी गुरु आपने गोविंद जो बताए, अगर आप बीच में नहीं होते तो हमारे को इनके जो सानिध्य का लाभ नहीं मिल पाता. बहुत बहुत आभारी है सर. आज आप पहली बार शायद हॉस्पिटल में इतना पधारे हैं, बीच बीच में पधार के हम सब लोगों के साथ में जान पहचान हो. बिल्कुल बिल्कुल. कभी पधार के हमारे को आशीर्वाद बनाए रखे सर. हम सभी आपके निर्देशन में ही काम करने को तत्पर रहेंगे.
तो आपको पूरा मोन्यूमेंट दिखाने लेके आके ट्रैक कराना था, तो फिर आप करते करते मैंने आपको पूछा, मैं क्या यार क्या बात, वो कोई बात ही नहीं कर रहा था. ब्रिटिशर्स है सर, बहुत पैसे वाले थे, बैंक स्टेटमेंट और ये वो. आपको देखा, मैंने कहा यार ये कोई एशियन कंट्री का है, तो मैंने कहा इनसे बात करते हैं. तो आपने कहा नहीं मैं कलकत्ता का हूँ, प्रिंस साहब का डॉक्टर हूँ. तो मेरे कान खड़े हो गए, मैं बात हो क्या बात हो. फिर मैंने आपको बताया, मैं कहा मैं आपको ट्रैक कराऊंगा, हिमालय तो नहीं ला सकता पर विंध्याचल रेंजेस में ट्रैक कराऊंगा. मेरे जितना फ्लोरोफोना बर्ड वगैरह नॉलेजेबल आदमी नहीं मिलेगा. तो आप खुश हो गए. और फिर 3 दिन वहाँ लेक पैलेस में जाना था, आप गए 5 दिन मेरे पास ही रहे, खूब करा. शाम को तो क्या कि इतने वो रोज रात कराया मैंने, तब खुश हो गए. वो जितनी नाराजगी थी वो दूर हो गई. कोई तो मेरे विस्की की बोतल ला रहा और कोई क्या कर रहा है, वो माहौल ही चेंज हो गया. पर उस रोज क्या कि जो मैंने देखा ना आपका चमत्कार, वो सूजन उसको वो स्ट्रोक आ गया था, एक लेडी थी. तो आपने एकदम, मैं तो घबराया, मैं कह रही इसका कहाँ ले जाएंगे इसको. तो आपने यहाँ नेक का और पता नहीं क्या क्या कर कुरा के, तीसरे दिन तो हमारे साथ वो वॉक कर रही थी. मतलब तभी मैंने कहा ये आदमी मैजिकल आदमी है, तो इससे संपर्क रखो. आपके वहाँ लंदन में भी मैं आपके हाउस पे भी रहा 10-11 दिन वहाँ. आपने कहा नहीं मेरे पास भी रहना पड़ेगा.
बहुत बहुत धन्यवाद.